So let me start by introducing myself. My name's Angela Hunt. I'm a registered nurse and an aesthetic nurse, and I manage Qutis Clinics, and I am our Coolsculpting expert within the teams. We have 3 clinics. We have a clinic in Witney, West Oxfordshire, a clinic in Tame, Central Oxfordshire, and today I'm at our Hemel Hempstead clinic, which is just outside Hemel in a little village called Pickett's End. And I Coolsculpt in the Hemel clinic here, and I Coolsculpt in the Tame clinic. All right. Today's event is focused on Coolsculpting and only Coolsculpting. And I'm going to start by talking about what is Coolsculpting. And I think in a nutshell, it's permanent fat reduction. So I'm permanently contouring your body to remove unwanted pockets of fat. It's as simple as that. So no surgery, no needles. Now, what makes Coolsculpting unique is that it's the only alternative to surgical intervention for permanent fat reduction, which would be something like liposuction or vaso, if you've heard of that kind of thing, which is a laser to remove fat, but they're both invasive. Coolsculpting is non-invasive, so non-surgical. When it's non-surgical, it means the risk is significantly less, and it also means the recovery time or the downtime is significantly less. Okay. The areas that we can treat for Coolsculpting. Now, this is quite specific. And again, it's because I'm permanently removing unwanted pockets of fat. And there's areas that you wouldn't want to remove fat from, such as the face. And there's areas that we would want to remove fat from. As you can see from the diagram, we take fat from the lower face, the submental area. Now, I'll start with that because I'm going to start and work my way down, but I'll start with this area. There's a few qualifying questions I ask, and if you can answer these yourself as you're in the audience, which will help you work out if you think this is a suitable treatment for you for this area. Coolsculpting only works on unwanted subcutaneous fat cells. Now that is the adipose fat, that's the tissue below the skin, above the muscle. It's the fat that you can grab and squeeze with your fingers. If you have unwanted fat in this area, or you think it's unwanted fat, there's a few variables that matter. And one of them is, how long have you had it? Does it expand and shrink with weight loss and weight gain? That's one way we can identify if it is actually fat. When I treat this area, it does reduce the fat, and it also does have a lifting and tightening effect on the dermis. However, for patients that are going into their, I'm going to say, late 60s, 70s and upwards, this can often just be a loss of volume from the face and skin laxity. And therefore, maybe surgery would be more suitable. But otherwise, I see fantastic results in this area. And we can contour the jawline following Coolsculpting for this area. Okay. I also treat the bra puff. So that's those little pockets that you get in a sports bra or a dress or anything. I do a lot of it at the moment in pre-wedding, and also young girls that like to wear sports bras or sort of summer tops, but we just have that unwanted pocket of fat there. We call it the bra puff. I can treat the entire back area really. So from where you can grab fat all the way down to just above your buttocks, just around your hip bone area. I like to contour that entire back area. I can treat the entire abdominal area, the outer thigh area and the inner thigh area, and above and around the knee area we can treat. And last but not least, arms. So this area here we can treat. And I've got a lot of lovely before and after photographs I'll show you. So how Coolsculpting works. Coolsculpting is cryolipolysis would be the scientific term for what we're doing. And I'm basically taking a pocket of unwanted fat and sorry, just stop videos and make sure everyone's muted. Sorry about that. It should have been automatic. I'm taking a pocket of unwanted fat and I'm freezing it. So I slightly kind of pull it away from the body. Again, this isn't an uncomfortable procedure, but I just very gently suck that away with an applicator, and the applicator is based on your body. So I choose that dependent on the size, width, depth of the pocket of fat I'm removing. Typically, it's multiple pockets in one go to get a nice contour. And I freeze that. I freeze it for 35 to 45 minutes, depending on the area of the body. And what I'm doing is causing those fat cells to become unstable. And then after the treatment process is done, we do a massage to return circulation to the area, to those unstable fat cells, and then apoptosis, or cellular death, occurs. This is a really nice visual image to give you an idea of how it works. So we start with this stubborn pocket of fat. And it's also a good time to point out that Coolsculpting is not a weight loss treatment. It's for body contouring, but it's fantastic for body contouring, and it has really amazing results if you are at the beginning. And I say this with emphasis as well. If you're at the beginning of your journey of wanting to just trim down or sculpt or do whatever you're doing, start with Coolsculpting, because I'm permanently reducing 27% of unwanted fat with each little pocket that I treat. I'm killing those fat cells. And through doing that, when you then embark on your diet and exercise, you see results so much quicker because you're working with less fat cells. All right. This visual image. So unwanted pocket of fat. I freeze those fat cells. Now, I'm not freezing the skin and I'm not freezing the muscle. I'll go on to that later on, but there's safety technology work that's built into the Coolsculpting machine, which is one of the reasons Coolsculpting is trademarked, CE marked, FDA approved with its safety features. But focusing on the fat right now, freezing those unwanted fat cells, they become unstable. Your immune system then goes in, and your little white blood cells, if we think of them as little soldiers, macrophages go in and they continue and complete the destruction of the unstable fat cells. And then over the course of 12 weeks, your body, those fat cells just naturally go away. You don't notice it. You don't notice it in your stool movements, anything like that. You might feel a little bit poorly after treatment in terms of sensitive, bruisey in the area of treatment, but nothing else. Because it's quite a gradual process. Cellular death can happen quite gradually. And then you'll see a 27, 28% reduction in contouring within that area. So what happens to your fat after the treatment? So as I've just mentioned, this is looking at the target areas that we would potentially treat. Because I'm contouring, I want to do typically more than just, it's not multiple treatment sessions, but it's multiple treatments in one session, okay? So I'll just show you I'll use my stomach. So if we're talking about an abdominal area, you wouldn't just, my paddle's on average about the size of the hand. The paddle would be sort of like this, like this, like this, like this, like this, like this, so that we contour that abdominal area to remove that unwanted pocket of fat. Okay, usually that's in one session, one treatment day, and that's it. You don't continue to come back and see me for multiple treatments over multiple weeks. It's usually one treatment. What determines how many treatments you need is the amount of fat, unwanted fat that you have. So this area, going back to this for an example, sometimes patients will require 2 treatments, but I wait the full 12 weeks to see the final optimum results before we decide if we retreat again. And then again, it's a conversation between the patient and myself. All right. Coolsculpting difference. So again, why would you choose Coolsculpting over some of our competitors? I'm just going to jump to the next slide and go to the science behind Coolsculpting. So originally, the sort of theory of Coolsculpting, the theory that fat is particularly sensitive to the cold, derived from a dermatologist, a pediatrician dermatologist in Mexico in the 80s. And he noticed that children had these pock marks on their inner cheeks. And he theorized that he thought it was from sucking on ice lollies, and the cold, the duration of cold being left against the inner cheek wall, was causing cellular death of the fat cells inside. It was later then seen in the 90s in Canada with equestrian riders. So female horse riders were coming in and they had this pock marking, again, indentation on their outer thighs from being out in extreme cold weather riding. And then that theory became research, and that research became evidence-based, and the evidence-based then formulated cryolipolysis and Coolsculpting technology, which is what we see today. And how fundamentally the sort of basis of this is, and this is fascinating, and when I first heard it, I remember thinking that can't be right, but we develop all of our subcutaneous adipose fat cells in our developmental years. So from being born to the age of 18 is when all of your fat cells are developed. From the age of 18, 19, you know, that full maturity age varies within an individual, but let's say from the age of 18 onwards, you don't create, your body doesn't create or kill any of the subcutaneous fat cells. What happens is they expand or they shrink with diet and exercise. But in the absence of surgery, prior to Coolsculpting, there was no way to permanently remove unwanted fat in the body. All you could do was shrink those fat cells. And this is one of the reasons, if you are, or if you have friends that were slightly overweight or obese as children, and then they lost that weight in their adolescence, but they constantly have this battle with, you know, if I look at a piece of cake, I put on weight. Well, that's because they're carrying more fat cells than the average person, and therefore struggling that much more to keep their weight down. And again, that's when Coolsculpting comes into play. Another thing that makes Coolsculpting unique, going back to those safety features I mentioned, and this is what patients really want to know about of late. How safe is it? You know, what's it going to do to me? It's, so first of all, I put a plate, I put a bit of gel and a sheet, like a bit of plastic containing glycerol and fructose. It's quite sticky, but it's about protecting the dermis, protecting the skin before I place the applicator directly onto the skin. The applicator itself is targeting the fat cells, not the skin. It has something called thermal detect in it, which means it's constantly monitoring both the temperature of your skin and the temperature of the fat cells just below the skin. If the skin becomes too cold or not, or if the fat cells become not cold enough, it will alert me and stop the cycle. And we then would either proceed again or we would move to a different area. This is rare that this happens. We call it a thermal event. If it does happen, it means nothing has happened. It's just sensed that something could happen, so it stopped it. And that technology in itself is what makes Coolsculpting FDA approved, which is the Food and Drug Authority out of the United States. And it's the only approved cryolipolysis technology in America, and consequently the most popular in America. And it's also CE marked, so again, approved for European safety standards. Personal treatment plan and how we go about Coolsculpting. So as I mentioned at the beginning, I will send you an invite, and we can do this virtually with it, just you and I. You tell me your story, tell me your journey and why you're struggling and what you would like to achieve. I can then tell you what I can do, and we can put together a treatment plan from there. All right. And we can either do that virtually or we can do it face to face across any of the 3 clinics. But as I mentioned at the beginning, Tame and Hemel are the 2 clinics that I treat at. So I'm going to give my voice a break and you a break. And this is a patient. So she didn't receive any benefit in kind for doing this, but she was so pleased with her results, we asked her to give us a testimonial. And you can just listen to her patient journey and how she experienced it. And I'll elaborate on a few of her points afterwards. Bear with me one moment. Technology is just going to overcome me, and I'm going to just open Kathy's system.
I felt that even with diet and exercise, there were certain areas that just weren't shifting and became a sort of bit of a bête noire on my back. So I felt that Coolsculpting would be a good treatment. I like the lack of downtime. I chose a reputable clinic, and I like the fact that it's painless. Absolutely fine. Everything was covered, very thorough consultation. I learned a lot that I didn't know before. All my questions were answered. I was completely happy. I was very, very well cared for. Everything was explained in great detail. Everything was explained prior to whatever was going to happen. I knew exactly what was going to happen during the day. So it was great. It was very thorough indeed. It wasn't painful at all. It was just a little bit cold, obviously, because of putting the gel on and the applicator heads. It just felt like a little bit of a suction cup. There was no pain. There was really no discomfort at all. Yes, absolutely. Because Qutis has a reputation, it's a nurse-led clinic, and the therapists are very experienced and, you know, under the umbrella of a medical aesthetic clinic. There really wasn't any recovery time. I felt a little bit numb in the area afterwards, and I was warned about that. And that did go on for a number of weeks. I can't say it was uncomfortable or I was inconvenienced by it. So there wasn't a recovery time. It was perhaps a little bit sore that evening, but yeah, mild discomfort. No, I suppose my only question was there a risk of a tissue damage with freezing it? And that was dispelled to me very quickly, so no concerns at all. I feel that it's given me increased confidence because I always felt that I had this bulge on the top of my bra. I had to have quite a broad bra because I'm big busted, and I've always felt uncomfortable. I hadn't wanted anyone to touch me on my back, always been a bit self-conscious. So that's really flattened it out nicely, and I'm expected to see results ongoing. Yes, I would absolutely recommend Qutis Clinic.
Thank you, my lovely patient. So just a bit of information from an actual patient and patient experience. And I think I'll go back a couple steps and talk about what you would experience from as a patient coming to us, start of treatment, end of treatment, and after, you know, leaving the next couple of days and weeks post-treatment. The journey would begin with the personalized consultation, as I mentioned earlier. And then you would come to us on the day, bring something to do, is what I would say. My treatment rooms, unfortunately, don't have televisions in them, and that's because they're back to back with my injectable rooms and my therapist rooms. However, you can watch a film or read a book, anything like that, because it's kind of like being on a long haul flight or a weird spa day, basically. We'll provide you with disposable underwear, undergarments, because as mentioned earlier, the pads that I use to protect your skin are quite sticky. So you'd want something, you wouldn't want to use your clothes because you just would feel sticky afterwards. So we'll provide you with all of that, robe, slippers, everything, and a catered lunch as well. So we bring you a menu on the day and you can choose what you'd like, hot and cold drinks, everything. Try and spoil you as much as possible. The treatment itself is weird. Painful is not a word I would use. Less than 0.1% of my patients have ever had an experience of pain during treatment. That being said, pain is very subjective. So it really depends. And if it's uncomfortable for a patient, it's because it's not the treatment itself that's uncomfortable. That's the weird bit. It just goes really cold, and sometimes really cold can feel hot, and then it goes numb and you forget about it. It's when I take the applicator off of the treated area and I do my 2-minute massage. My 2-minute massage is imperative. It improves results up to 70%. And that again is because I want to return full circulation back to that area to get the white blood cells, our little soldiers, to continue the destruction and complete the destruction of those unstable fat cells. That's the area, that's the area of the treatment that feels weird, uncomfortable. And it's like, I can equate it to having a dead arm. You know, you fall asleep on yourself, wake up, and you don't know whose arm this is. And you get that pins and needles tingle feeling back. That's what it feels like. It subsides within 5 minutes, and then we carry on to the rest of the treatment. After treatment, so the next few days and even weeks onwards, but typically the next few days, you'll feel tender in the area. So say we've treated the tummy area, you'll feel like you've been to Barry's boot camp and had the most intense abdominal workout, but you haven't done anything. And that's how it will feel. And it's not impacting the muscles, but it feels bruised in the area. It might look bruised. Typically, bruising can happen here and on the flanks because it's a visceral tight area, so the suction's greater, but the bruising isn't a typical type of bruise. It's purpura, so it's from the suction of the applicator. It looks like a hickey, basically. I see bruising about 25% of the time, and it goes within 2 to 3 days. I've never had a patient complain of bruising, so I say it with a pinch of salt. You'll have a little bit of swelling as well. So I always say don't have Coolsculpting a week before you're going on a beach holiday. But otherwise, you can have it anytime. And then you can feel numb in the area, which isn't painful. It's not a bad thing. It's just a weird thing. And that can last up to 6 weeks post-treatment, but it won't impact your daily life. Again, never had a patient complain about the numbness. They just say it was weird. All right. So some before and after photographs, and I think these are the testament to what the treatment does and how fantastic it works. This patient is in her mid-40s and she had her lower flanks, so muffin top area, treated. And this is 12 weeks post-treatment. Now this patient is about 10 stones, fit and healthy, but always struggled with that muffin top, regardless of what the weight did. And so pleased with results, they came back and had their thighs and arms treated. When will you see results? Now, Allergan Coolsculpting, say from 4 weeks post-treatment. My experience and all of my patient feedback, typically, I do have patients that say they start to see results from 2 weeks post-treatment, but I say as a blanket expression, 6 to 8 weeks post-treatment is when you'll start to notice the results. 12 weeks is the optimum for results. And that's when I take the before or the after photographs and stitch them against the before so we can see those results. However, over 70% of patients continue to see results up to 6 months post-treatment. You don't have to do anything after treatment either. So because Coolsculpting, the science works, you don't have to, I'm not going to put you on any crazy diet. I don't say drink 3 liters of water a day, nothing like that. I encourage my patients to stay hydrated and eat a well-balanced, low sugar, healthy diet. But I don't want you to change anything to see the results. I just want you to maintain what you're doing. And this is why, going back to what I said at the beginning, when I said, if you're on a journey of, trying to get fit or wanting to just sort of take better care of yourself, or if you just take better care of yourself, regardless, having a bit of Coolsculpting is such an amazing motivator, because sometimes we work really hard and we're really committed, and you get 8 weeks in and you think this isn't working and I'm losing my motivation. The beauty of Coolsculpting is you suddenly see results, and then you feel encouraged to think, oh, I feel really good about this. And then you keep going, because there's nothing better than feeling great in your clothes, is there? This patient, she is in her late 50s, and her complaint was her tummy. Menopause has a big impact, and I see a lot of peri, during, and postmenopausal patients. And it's because our estrogen levels change and progesterone levels change, and that results in us holding abdominal fat around our middle more, and we struggle to get rid of it. And this was her challenge. So she had one treatment session with me. I treated her entire tummy, treated to completion is what I call it. And I treated her love handle, her flank area. And this is 12 weeks post-treatment. And she was really pleased, and we didn't treat any further. This patient is in her late 50s as well. And she had 2 treatment sessions with me. Now, these photographs are this photo is to isolate her thighs, and I'll show the next photos. I can show you her abdominal area, but this was her inner thighs. And I can appreciate it's a little bit difficult with the black, but what you're looking at is the gap in between. When I'm treating inner thighs, because I'm treating your profile, your contour, I'm very careful to make sure it's complementary, because I'm permanently changing your body. So I want to do it in a positive way, of course. And again, for her, she's a very petite woman, and it was the rub that she wanted to reduce. And as you can see, we did that just with one treatment session, 12 weeks later. This is the patient from before, but a different angle, so you can see the love handles, that pocket, and how we've reduced it. And this is a really good example of expectation setting for you. So what I can do, what I can't do. But this is very realistic. And age as well, to go back to that for just a moment, why I say the patient's age or give you a round estimate number, it's not overly relevant. Of course, the younger you are, the faster your metabolism is, so it may be indicative of a hyper responder. However, I have treated patients up to the age of 74, I think would be the oldest age of a patient that I treated. And again, as young as 20, 25, I prefer to not treat patients that are too young, because going back to what I said earlier, again, developmental stages, your body's still changing. This is the patient that I showed you with the inner thighs, but this is her journey from the very beginning. So she had one session, 8 weeks later, she came back for her second session, and her treatment was on the front of her tummy only. So the first session was to reduce the bulk of her belly, which just, again, she's a petite woman, she's very little, and she just felt all belly. And due to arthritis and lifestyle, she didn't have the opportunity and couldn't really do, extensive physical exercise, but equally diet wasn't shifting her midriff. So this is 12 weeks post the second treatment session that we did, treating her tummy to completion. Note her skin laxity. She's had 2 children, and she was overweight in the tummy area, and we've reduced that fat significantly, as you can see. She's a sun worshiper, and she wasn't really bothered about the skin laxity. It was more about the bulk, but skin laxity can be a consideration, and it's something that I would talk about face to face, because it depends on my patient, the quality of their skin, if you've had children, all of that kind of stuff. Again, different angle for both patients, but just what Coolsculpting has done for both of them, and they're both ecstatic with their results. This area, this patient is in her 60s, and it's the submental area. She was concerned about skin laxity because of her age. However, she had excellent skin laxity pre-treatment, and therefore, and she didn't have an excess of unwanted fat here. It was a pocket, and she was an excellent candidate. And as you can see from the photographs, she was really pleased. And we went on to do a little bit of contour work for her jawline to just sharpen that up for her. Inner thighs on a patient in her mid-40s. This is actually the patient I showed you earlier. I only have so many before and after photographs that I can get consent to show virtually. But inner thighs, again, this is fit and well patient, but just wanted to reduce the rub on the inner thigh. And as you can see from that gap, we've achieved it, and she was really pleased. This patient's in her early 60s. So this is, again, an indication of age doesn't really, it's not that much of a variable to consider, but she had very thin arms, very thin legs, but long torso, and just couldn't shift the weight due to hormonal changes in lifestyle. 2 sessions of Coolsculpting. This is 12 weeks post the second session. I've treated her back and her flanks, as you can see from that profile photograph when you're looking at her from the back. You can see the reduction in the muffin top and how we've just shaped her waist and flattened her off in the front. This is a patient in her early 40s, and this is a post-baby belly. And because post baby belly and going back to work, so newborn child and going back to a relatively full-time role, she just couldn't shift it. So we did a session just on her lower tummy, and this was 12 weeks later, and she's really pleased. And I still see her for other treatments, and every time I see her, she tells me how fantastic the results have been because they're permanent, so they stay. Outer thighs. Now, outer thighs, I will typically treat twice. I set that expectation, but it depends on the amount of fat, and I wait a full 12 weeks to see the results before I retreat because it's an area that you wouldn't want to overtreat and cause any kind of indentation. This is only 6 weeks post the outer thigh results. And this patient's only 8 stones, but it was just her body type. She was really pleased with these results. Outer thighs again. And this is 12 weeks post 1 treatment session. And this patient came in for her post-treatment photos in little shorts. It was the summer, and she came in little shorts, and she said, "I haven't worn shorts since I was about 16." And that was really nice, a nice testimonial to the results. Arms. So what you're looking at is the bottom of the arm. You're looking here, and you can just see how we've just contoured and slimmed that. And again, this is a really good example of expectation setting. That's a beautiful 27% reduction in the lower arm. And that was all the patient wanted. They just wanted that little bit of trimming just there so that she felt more feminine, because she's a slim, petite woman, but she felt it all sat on her upper body. That was 12 weeks post. And again, same here. This is the patient from the beginning with the love handles and the inner thighs who went on to have her arms treated, pre and post. And again, just wanted that contouring done. Tummy. So this patient is in her mid-30s. She's had 2 children, but she just works full-time and has 2 children at home and couldn't get that tight tummy that she had pre having the girls. So I did something called a Cool Smooth Pro, which is my flat cycle that I do on the outer thighs, but I do this on the abdominal area. And I'll often do this at the end of a tummy treatment session as a final treatment, 6 weeks post, to just tighten and lift everything. And it just gets rid of that last little bit of unwanted fat to contour the abdominal area. It gives beautiful results. It also tightens and lifts the skin. Men, we treat a fair amount of men, often husbands of wives that have had great results, and they go home and the husband sort of says, "Oh, wait, I want some treatment." This was a chest area, and this is 12 weeks post. This is a really good example of a submental area. This patient is in her early 40s and always struggled with this area, multiple factors involved. And 12 weeks post, and she has a beautiful jawline, but it was just reducing that, and she was really pleased. Again, this is a nice angle for you to see. And if you look at the alignment of the ear and the nose, you can see that I'm not sort of getting the patient to do that, but it looks like I've extended her entire jaw just by reducing that unwanted pocket of fat. Okay, thank you for your time. I'm going to open it up to questions. As I've said before, I will email you the invitation to come and see me. You can either see me in clinic or we can do it virtually. If I have preference, I'd like to see you in clinic so I can physically touch you and set expectations, but virtually works just as well. So whichever you prefer. My first question. How long do the results last, and how long does the treatment take? So first answer, results are permanent. So the only way that you would see a difference in those results. So let's go back to treating the tummy area. Say I treat the tummy area to completion and we get that beautiful 27% reduction on the overall tummy. You'll maintain that forever, unless if you, of course, go and put on 20 kilos or, put on a significant amount of weight, have a baby, even having a baby, changing the abdominal area. You will have remaining fat cells there. They can still expand, but you'd have to put on a significant amount of weight to lose the results from Coolsculpting. That's the answer to the first question. The second question was, how long does the treatment session takes? That depends on what we're treating and the plan. Sometimes patients will be with me for 3-4 hours. Sometimes patients will be with me for an entire day. So 8 8 hours, and we become very friendly. But we can split it across 2 days. Again, it's something I would go into more detail with during the consultation. And during the consultation at the end, I would clarify cost, because that's very difficult to do until I've seen you. And I'll clarify exactly how long the treatment would take so that you can plan your day around it. Would this work on a C-section tummy with an overhang? Yes, I treat a lot of C-section tummies with an overhang. What I concentrate on, typically on a C-section tummy, you don't have a lot of fat remaining under the scar. It's everything over the scar, and that's what we focus on. You might still find, it depends on how your skin is around that area, you might find that you still have a little bit of loose skin in the remaining area, but we can certainly contour and flatten and reduce that unwanted fat in that area. And then we have other treatments that help with skin tightening and skin laxity, something called Profilo and something called radiofrequency. And that's something I would talk about with you one-to-one. Please let me know both of those questions. If I haven't answered them, just follow up with another question. Last question, and then I'll ping you an email. You mentioned discount, in the invitation. How does that work? And how safe is this treatment? Okay, so I'll go to the safety question first. It sort of goes back to what I said about safety in the panels. So you do sign a waiver that says there are a few risks. We would go through that one-to-one, but those risks are significantly less than if you were to have surgery. And the risks are also less than 0.1% over, it's now coming up to 10 million people worldwide that have been treated with Coolsculpting. I have yet to see an adverse event or a negative result from Coolsculpting. The worst case that I've ever seen would be a disappointed patient where we haven't quite gotten to where we wanted to go, but that just means another treatment session. And the only one that I can think of where I had a disappointed patient was this area here. She was in her late 60s, and as much as it looked like fat, talked like fat, felt like fat, it wasn't fat, and we just couldn't shift it, and I ended up referring her on to surgery. But otherwise, I really happy patient feedback. And discount. So you do, there's a treatment reduction as a thank you for signing up and joining our virtual event. And I will discuss that with you when I put together your treatment plan during our one-to-one consultations. All right. Thank you everyone so much for your time. I look forward to hopefully meeting you in clinic very soon. Following my email, I'll send you a recording of this event today. If you have any other questions, don't hesitate to get in touch with me. And hopefully I see you all soon. Thank you.